So my name is Sarah Saleh. I go to Nova Southeastern University. I'm a D2 student, and today is a day where AMED came and showed us some of their microscopes. There's a lot of different companies that brought different microscopes, and each one had its own characteristics and stuff like that. And it was really cool because it's the first time I use one. I've seen them before. I've seen them in offices, but I've never actually worked under one.
So I really didn't know what to expect coming into this. I knew we were going to be working with microscopes, but I didn't really have a good idea of how well I'd like them or if it would really make that big of a difference, because we do use loupes at school.
For the past few days I did see a lot of boxes coming into SimLab, so I knew something great was coming, but I did not expect the amount of microscopes and all the hands-on things that we got to do.
I got an email talking about a course they were offering for microscope dentistry, and I didn't even know that existed. When I think about microscopes in dentistry, I think about our loupes. You know, I use a 2.5 magnification loupe, and today I went up to, I think one of the doctors told me I was at 12 magnification or 14, and so the things that I was seeing, I mean, I don't see normally when I'm using my loupes, and that totally blew my mind.
So never seeing a microscope before, it was really interesting having that opportunity to use this completely new technology. I really liked the fact that I didn't have to have my head down like I do with my loupes, and the field was so large, so I could see multiple teeth at a really high resolution. That was new.
It was similar to my loupes, but it was still, my visual field was a lot larger. And then as I started zooming in, I went, okay, I could see more, and then you keep going up and you can see more and you can see more, and you're like, I didn't realize that this was even possible to see this much. So it was really just a neat experience to see that happening and to be able to adjust yourself, and then to be able to take your handpiece underneath the microscope and actually be able to use it properly under it was really a neat experience, and it's something that I'd like to have more opportunity to practice with because it really made a difference in our work today.
Based on the prep that I did originally, and then I had one right next to it today that I did in the microscope, it was just so much more clean. The lines were smooth. I could see my finish line impeccably when I did that veneer prep. I think that just the quality of the work went up in a matter of minutes using this microscope.
It was interesting to see the difference of the preps we do on a daily basis and to be able to see them under the microscope and see how much more refined we can make them. As dental students, we are very picky and we're perfectionists already, but putting it under a microscope multiplied that times about 100.
My experience today was excellent. Not only being able to work with the microscopes today, to learn about how we can use this excellent tool to magnify our field of view and see our work so much more magnified, but also being able to work with all of the doctors that came to visit from AMED today. It was excellent to hear about how they utilize these microscopes in their practice, and not only just to see and improve their own work, but to educate their patients by showing them what they see under the microscope.
And it can help you communicate with your patient and have them understand where you're coming from.
I think it would definitely relieve some of the neck pain that I'm already kind of experiencing, and it's only been 3 years here. So that was a big plus of today, was that I could just sit up and do my work. I also think it would be something that would help me communicate with my patients a lot better. That's one thing that I find there's a small disconnect, maybe in a large disconnect with some people, is that I really can't communicate what I'm seeing in their mouth or what I'm seeing on their x-rays to a visible platform for them. And I really liked that today I could see really close up irregularities in a tooth underneath the microscope put on a big screen. And I feel like for a lot of my patients that really maybe don't understand what's going on in their mouth, that would be such an eye-opener, a great tool, and maybe help them understand that, yeah, this cavity is something now, I can see it, I know that I need to have this fixed. And I feel like that would make the trust between provider and patient a lot better.
I just prepped the whole tooth, and I didn't even have to bend. I didn't even have to check it bending my neck or anything like that. I just stayed as I was, prepped the whole tooth in the same posture. My neck was back, no neck pain. I tend to have bad neck pain, and I had none.
I was able to prepare it much faster with more precision, and also I didn't need to refine my prep as much as I would do with my loops. I could do pretty much everything without changing my positions, without changing the way my back was. I was just there from start to finish, and everything in the end, when I pushed the microscope away and I put my loops to look at it, I just saw a great finish line and a polished prep.
We don't really realize how we're twisting our bodies and sitting in these uncomfortable positions until after the fact, when you go home later that day and you realize, wow, my back kind of hurts. And even at a young age, it's something you don't want to deal with, and leading into your career, it's not something you want to deal with over the long term. You want to have a long, prosperous career. And I think for me, what really was the take-home message was that we can improve our ergonomics and have a long career. We can do better work on our patients, which is really important because we're able to see everything. We're able to preserve more tooth structure, which I also think is important. I'm just really happy that I came today, and I learned a lot in the few hours that I was here today. It's helpful.
It would be really awesome if we could use microscopes at Nova in the pre-doctoral program, because I really saw the benefit today.
It was beyond my expectations, and I'm really sure it was beyond any of my classmates, that we got to figure out how to work the different devices, the different microscopes, magnification, lasers, veneers, you name it, we got to do it today. That was great.
It gives us the opportunity to expect more out of ourselves and more out of our work. And I think that will eventually be very beneficial to us if we're able to get our hands on one of them and use them on a daily basis.
I learned a lot, I got to do a lot, and a lot of these things I will be considering when I graduate to implement them in my practice.